there's nothing you can do to change the numbers of women in the profession or how people are going to instinctively react to those dynamics, just like you can't, as much as some people may want to, like change their family dynamics. And in an advanced training program, like it is a family, right? I will say though, like that feeling is not an unhealthy one, right? It's a normal reaction to what's going on. You can't be guided by it. I think there can be a tendency to sort of not do your best because you're always feeling like, well, what's the point? I'm going to get overshadowed by this person standing next to me. And that person doesn't like feeling like that either. I mean, if you're the favorite child, you know how that is. You're like, God, I can't stand like my brother or sister complaining about how they never get their way. Like, just shut up and be good like me. So I think that there's a little bit of both. And just understanding that you can rise above it and that like recognizing it is the first step, finding somebody that you trust and not just like devolving into someone who complains all the time. There's a big difference between like venting, which is healthy, and like actually like complaining, getting stuck in the mud and beating an issue to death until people don't really want to be around you anymore because you're not nice to work with anymore because you're always feeling like a victim. And that's not good for us as doctors, that's not good for our patients, and it's really not good for us as women, right? Because then people are going to start looking at you like just some, whiny little brat, and not look at the things that are great. Like you are going to actually fulfill that role that you feel like you've been pigeonholed into. And so I try, and I still think back in life, I get it, like I understand why some of our behavior that came out during my training wasn't maybe our best selves, but that's okay, it's like growing up, right? And I'm lucky my best friend in my training program, like he was a favorite, like the old and trying still is. But we also, like that camaraderie was so important. And I think that we have to really put ego out of it and the things that we're creating and the patients that we're helping and the way that we're learning. Like we need all kinds, we do. And it doesn't have to be a situation where we are always so worried about being treated unfairly that becomes like that guiding voice. We need to find what guides us, and for me it's always best medicine, best patient care, and like how can I communicate better with those around me and like lift each other up and not bring each other down. And then the last point I want to make is the importance of role models. It was during my clinical year that I was lucky enough to really meet a woman that I looked up to in her career. She was double boarded in critical care and internal medicine. I thought that was so cool. And she was married. She was 37 and having her first baby at that age. And she just really was somebody who showed me, wow, like you can do these things and like have a life if that's what you choose for yourself. And I'd not really seen that before.